So a dental implant is made of titanium and it fuses with your own bone underneath your gums. And once it's fused with your bone, we tend to put a crown on it, just like what we do with normal teeth. And once that's done, it functions like a normal tooth and it looks like a normal tooth. So dental implants tend to replace the missing tooth and therefore protect the adjacent teeth from moving into the gap. When you lose a tooth, the adjacent teeth want to move into the gap and opposing teeth would want to move down into the gap. And this is something that takes time. But what happens as a result is that we can compromise the bone support and the gums around the adjacent teeth. It also prevents you from just chewing on one side, because patients, when they lose a tooth on one side, they tend to shift food the other way. So all in all, I think dental implants is a preventative treatment, and it makes sure that you can eat your food properly and smile well. Dental implants are expensive if you compare it to other types of dental treatment. The reason is that they are expensive to buy. The materials and components are expensive, and there are lots of different types of implants on the market, probably more than 200-300 types of dental implants. We only use the very best on the market, and also the prices are dependent on the qualifications of the dentist. So if you're working with someone who's qualified in dental implants, usually the price goes up. But I've never had a patient going through the treatment wondering where the costs are going. And in fact, most patients that go through the treatment, they say they would have it again. Most people can have dental implants. There is no age restriction. In fact, the oldest patient that we have treated with dental implants is 87 years of age, and he can chew so much better. He probably live longer because he can eat properly. The only time we don't tend to do dental implants is when we have patients with a complex medical history, or when we have patients who can't clean their teeth. So an implant consultation is booked for half an hour, and it's an opportunity for me to meet you as a patient and for you to tell me what you're looking for. So some patients, their main concern is just a loose denture. Perhaps you have many missing teeth that need replacing. Perhaps it's a confidence thing, or it might just be functional. So it's a good time for me to just see what your expectations are. We also look at what the risk factors are in your case and how successful your implants will be. We look at costs. I'll be able to provide an initial cost estimate for treatment. So dental implants can last forever. There are studies coming out to say that if we maintain our implants properly, then they can last for the rest of our lives. So it very much depends on how well you clean them and how well you follow your instructions. So dental implants do need maintenance. It's kind of like buying an expensive car. It just needs regular servicing. So on the whole, we tend to see our patients once a year if they are low risk, but some patients do need a few more visits because they need help from us to clean the implants, and then in that case you would be seen a bit more regularly. And this is again discussed at your first consultation. So pain is one of the things that most patients worry about when it comes to dental implants, because they don't understand what we are actually doing. So dental implants is it's like keyhole surgery. So you make a little opening in the gums and you place the implant in. Now extractions tend to be far worse than dental implants because you're putting something in rather than taking it out. Most patients tend to take painkillers, paracetamol or ibuprofen for 2-3 days following procedures. During the treatment you have local anesthetic, so it's not painful. I've never had anyone thinking that it's extremely painful. If anything, you get a bit of swelling and bruising after the procedure.